a couple of weeks since the video diary's been up and going. Been away on holidays, which has been a fabulous time to get away with the family and back on board now. So it's been great. Big thanks to my locum, Carl Barker, who looked after the clinic really well. Had some difficult cases to deal with. It's always the way. Just before you go, you always have a little bit of a drama. So we had a little bit of a drama with the horse. Had a small puncture wound in the back of the fetlock. Went through the annular ligament into the tendon sheath and into the superficial digital flexor tendon. So it was it's an interesting one. They're difficult ones to deal with. Tendon sheath infections can potentially be life-threatening. But this horse responded really well. We did some intensive antibiotic therapy, so IV antibiotics, and also what we call regional perfusion, which we got a short video of it at the end of this, so I'll take you through what we did, and it went really well. So procedure went well. So back on board, well and truly. Melbourne weather's nice and cold, keeps us nice and fresh. So we're just following through. So some really exciting things coming in the next few weeks. I'm hoping to try and keep this video diary up and going. Really enjoyed the feedback. There's a couple of topics people have brought up. Uveitis, young horses, when to start them, what to do with them, and also how much work to do, and what, how you manage the training to avoid work. So I think that's an interesting topic as well, and can go on quite a while. So we'll dig up some images and go through that there. So today's been a relatively steady day. Just following up on a few cases while I've been away, and just working out management plans for them. And this afternoon I've got some foot balance x-rays. Really good thing to do just before shoeing. So this one horse has had a bit of time off, and I gotta take some x-rays, see what his feet look like. So back later, and we'll see how we go for the rest of the day. Alright, thanks very much. Bye. In this video, we're just having a look at how we deal with tendon infections and tendon sheath infections, more to the point. Just here, we're trying to get a sample of the tendon sheath. Often when we've got a penetrating wound and a cut in the tendon sheath, it's hard to get a sample. One of the reasons why we do want a sample is actually so that we can try and do some culture results and see what's bacteria are present, and also what they're susceptible to antibiotic wise. So in an ideal world, we get a sample, but sometimes it's not possible. You just see here we're applying a tourniquet to the leg. So this is where we use a rubber band and actually try and occlude the blood vessels to stop any blood coming back into the leg. And the reason for this is we want to do a procedure called a regional perfusion. So regional perfusion, as you see here, I'm just palpating the veins that you palpate over the back of the fetlock joint if you're looking for a pulse to the foot, and I'm going to insert a catheter into that vein. It's a very small catheter. It's not a massive vein. It's not like a jugular vein, so you've got to be very sensible and sort of very sensitive when you put that in. So we pop the catheter in, and you'll start to see blood just slowly come out of the top of it, and we remove the stylet, so we leave that catheter in place. So we've got the catheter there, and I'm double checking that it's in place and it's ready to go. We have to be careful that it is in the vein, because if it comes out, we can actually do some damage to the skin and get antibiotics under the skin. So just removed there. You'll see very closely in the screen there is drips of blood coming out of the catheter, and we're just getting ready now to put antibiotics. The reason we do this is we manage to get a really high concentration of antibiotics into the infection area. So we keep this tourniquet in place for about 30-35 minutes. It's done under standing sedation and local anesthetic. So we do perform a nerve block so the horse can't feel its lower leg. So the tourniquet is not causing any pain. You'll see in the syringe there, I'm just checking all the time that I've got some blood in the veins, and I'm still in the vein. So it's a really good way, because we've just applied the tourniquet around the leg, we haven't pumped any of the blood out. You will get blood in the veins, so we can check all the time that we're in. So this here will be done and left in place for 30-35 minutes. We use an antibiotic called gentamicin in this case, because it's a really suitable antibiotic for this type of injury. It's an intravenous antibiotic anyway, and it has a good spectrum of activity. So we leave this in place 35 minutes as said, and then we actually then repeat this every 2 days. So the horse is still getting IV antibiotics and intramuscular antibiotics, but we're also repeating this every 2 days and injecting antibiotics into the tendon sheath. That way we can really keep a high concentration in the local area. So this horse has had a great recovery. We've managed to treat the infection. It had 5 regional perfusions in total. So we alternate between the inside and the outside veins just to give them a break, because obviously every time you stick a needle in them, it does damage them a little bit. Horse has done really well. The wound came from a very, very small, inconspicuous little puncture wound, probably 2 millimeters in size. But when we ultrasound, there was A, a lot of swelling, B, quite a lot of lameness, and C, when we ultrasound the area, we could see this penetrating tract that ran right into the tendon. So the horse has recovered well, sound, now off antibiotics. All through this procedure, we actually don't use any bute because we don't want to mask any signs of infection. We want to make sure we're heading the right direction. There's an improvement in lameness. So we use lameness as a good guide of how the infection's tracking along. And this horse just continued to improve every day with treatment. So he's now off all treatment, and we'll go to the paddock for a break. So we can let the tendon injury heal, because there's a bit of damage to the tendon, but should have a good prognosis. So great result, and it's just another procedure we can do in the field to treat those nasty wounds and stop an infection getting hold. So I hope you enjoyed that sort of session on tendon sheath injuries. I hope to try and get some more videos together in the next few weeks and get some more procedures documented. We do. Again, any questions, please feel free to send me a message, and I'll happily try and discuss them down the track. We have got a few to tick off, but now I'm back on holidays, back on board. Look forward to doing it more. Speak to you soon. Bye.